This is my filling of an oral prescription and the filling out of a controlled substance log. So we sent home oral buprenex with cats who need the medication after our painful surgeries. I do want to say that before we get too far into this video, I did realize when I show later on my syringe full of the medication that I was wrong and I did correct that. I originally had pulled up I think it was 0.16, and I needed to pull up 0.15, but I did correct it. It's just me double checking what I needed to pull up. I didn't realize that the black part of the plunger is what I needed to pull up towards and not the white tip of the plunger. I did try to get as many air bubbles as I possibly could out of the bottle and or out of the syringe. Or I can press the bottle. Yep, see, I pulled it up to the white part of that plunger and I needed to pull it up to the black. So I did correct that. I mean, with that bubble, I needed the right amount. I'm kidding. I did learn that with those tips added on, it does push it down. So when we're recounting somebody else's draw up, we have to take the cap off and push it up to make sure that it's the correct amount. Since I am filling a controlled substance, I am going to leave this entire video intact and not cut any parts out. They were asking if I was recording. I was joking around that I need to make up a little sign that says recording in progress and just hang it up when I'm recording. This is me double checking that I'm pulling up to the right line and realizing that I wasn't. So I separate it and I fix all the ones that I had previously done before I pull up any further. as we're sitting here watching me fill this, I do want to apologize for the little watermarks on each video. I am a college student who can't afford the editing software, so in order to use the software, I am using the watermark. Making sure I put everything back in the lock cabinet that I need to. The outer door is a little hard to lock. I was trying to decide if I should pause it or not yet. I had to double check if it was for pain management, because sometimes they just put like clinical use on the log or owner use. And I wanted to make sure I was writing down the correct thing. I don't remember what the question was I just asked there, but I do know that I asked a question. So once I initial, I put the medication into the bottle, cap the bottle. Of course I have somebody recount it. But until they usually recount it before they send it out with the owner. So that will be, so the medication will be locked inside the lockbox over by the kennels until it is time to send the pet and the parent home with the medications. And then this is just the controlled substance log. I do show you where I put my entry. I forgot to put the grams. Did I forget to put grams? I don't remember. But covered up the owner of pill because privacy. And this is me reconstituting a lepto vaccine. So I have my needle, I have my syringe with the attached needle on it. We use Loralox. Pull up the sterile gel since our leptos are reconstituted with a gel versus sterile saline, even though it looks exactly the same. I was shown multiple ways of doing this. I was shown to shake it like that or to roll it gently across my hand. But it mixed up all of the powder, and I pull it to just where the bevel is on the very inside of the cap, pull up the vaccine so that way I'm not leaving anything behind, recap my needle, put my label on, if I can get it to not stick to my hand, and change out my needles. I put my sharp away first so that way I'm not leaving it out on the table. And voila, the vaccines are done.